sorry about that. I had to step away for a second. Okay, open up for me. Okay, now I think we got most of the tartar down there on your bottom teeth. You really need to work harder on brushing, especially right up under your bottom teeth here in the front. You had quite a bit of tartar buildup there. Let me take a look here one more time. Okay, open up for me. I'm going to suction that out just a little bit. I'm going to look at that, okay? Hold still. Okay, move this way. Okay. That's better. I think we got it. Okay. Now, I have something that I need to tell you. We have a new dentist since you were last here. Her name is Dr. Benson. Have you seen her before? Have you been here? I didn't think you had. She's well, I'll just let you meet her, okay? She'll be in just a minute. Hey, it is so nice to finally meet you. Can I shake your hand? I don't have gloves on. Is that okay? Thank you. I told Laura to set you people up. You know, do you mind if I set you up? I tell her not to leave y'all lean back because all the blood flows to the wrong areas and it's just unhealthy. It's bad for the brain. You know that, right? So, here, you want to sit up a little bit more? You don't look comfortable at all. You're all buggy-eyed. Are you okay? You don't look good. Is that better? Are we good? Okay. I am Dr. Benson. It is so nice to meet you. I can't tell you how I'm thrilled to meet you. I know a lot about you because honestly, I saw you were coming in, and I don't want you to think I'm a stalker or anything, but I kind of looked you up on Google, and then I found you on Facebook, and I read back to like 2008, all the stuff you've been doing, and you have a really interesting life. That's fascinating. So I see that you moved recently. I have been thinking about moving to that area. What do you think of it? Oh, I found that in the tax records, for the county, You can look that stuff up. So all I had to do was look up your name, and it went right to the house, right where you live. It's beautiful. I'll be honest, I went by there. Yeah, it's nice. Really nice. Maybe I'll run into you sometime. You see, sometimes I walk on that walking trail over there. It'd be really great. Maybe we could do something. It's too soon. You're right. I'm sorry. We just met. Yeah, I'm sorry. Absolutely. No, I don't know. Well, no. So your old dentist moved out of town. I don't know where he went. But I took over his practice, so I'm it. I'm your dentist now. Is that you okay with that? Is it good? Is it awesome? Well, I don't know what Laura told you. Sometimes she kind of prepares people before I come in because I'm a little unconventional. I'm a little weird. So that's what I saw that she posted on Facebook. I'm not going to fire her for it or anything. It's her honest opinion. I don't understand bosses firing people for stating their opinion because she thinks I'm weird, maybe a little crazy. But again, we're all entitled to our opinion. So you're here today for a cleaning. I have to say, you have remarkable shoulders. Can I touch your shoulders? Can I just, I don't mean anything by it. My hands are clean. Is it okay? Okay. Just, wow. They're a little spongy on the sides. Remarkable. Do you work out? Do you do a lot of gardening? Well, that counts. See, we did x-rays last time. Let me look at them here. Hold on a second. I'm going to look at the screen right here. Uh-oh. Just open up for a second. Let me see something. Wow, your You don't mind that I don't use these, do you? I mean, you look fine to me. You don't have like leprosy or anything, do you? I mean, you don't look like you do. You're fine. So actually, I don't like these. So we're just gonna get rid of those. Do you mind if I stick my hand down in there for a second? I need to check something. You have a suspicious spot on that tooth back there. That worries me. That was not here when you came in 6 months ago. Now I'll show you what I use here. Now, I know Laura has her own implements that she likes to use. She uses that water pick thing. It's like a high-powered water pick. It's like a water pick on steroids. I think those are for wimps. I go with more primitive tools. So I use these right here. And I clean these myself. Now, I use hot water in the dishwasher. It's just as good as the sterilization procedures that you can pay for. See, it saves money if I just throw them in the dishwasher at home and then bring them with me. You cool with that? You look like the adventurous type. So, and I washed my hands earlier. I washed them when I got here, so we're good. All right. Yeah. All right. Open up. I'm gonna poke it. I'm just gonna stick. I want to. See, you have a little bit of a white filling right there that is starting to deteriorate. Do you know how long you've had that? Oh, that's not my work. That's Bush League right there. I can do better than that. You have beautiful teeth. Has anyone ever told you that? I mean, I know it's not much of a pickup line. I mean, it's not something you're going to hear sitting on a bar stool somewhere, but you have beautiful teeth. Like the shape of your teeth. They're beautiful. Are they real? That's a silly question. Of course they're real. If they were dentures, I could tell. Wow. Do you mind if I touch your teeth? I mean, like, not for diagnostic reasons. I just want to touch them. I want to see. Oh. Hold on. I want to stand up for this. Tilt back. Just indulge me here for a second. Tilt back. Open up. Oh, golly, beets are smooth. They feel like pearl onions. Wow. You have fascinating gums. Wow. I just can't even believe it. Okay, raise up. No. Don't sit up. Hold your head up a little bit. I'm going to touch your neck. Don't freak out, okay? I'm going to give you a massage right there. I'm feeling the back of your neck. It's like spaghetti. Oh, that's your hair. That's nice. Doesn't that feel nice? Nice little neck massage in the middle of the day. Okay, enough of that. Sit up. You seem tense. Why are you so tense? Don't be tense. Do you have any concerns at this point? Anything that worries you? Well, I don't know what I can do about that. I'm not really a dog trainer, so I was kind of referring to, this part of your life here. Okay, well, this tooth back here, I'm just gonna mark that as a watch on your chart, okay? Let me get your file a second. I need to ask you something. I need to ask you, and if I'm being nosy, just tell me, but I have to know. Do you really think going to that church picnic on Sunday is a good idea? I know you're looking forward to it. I know you're making tuna salad, but look, you did not see... Listen to me. You did not see what your Aunt Robin said about you, okay? She called you a sleaze. Now, I don't know what's going on between you and your Aunt Robin, but you may want to rethink it because she's already telling people that if you go, she's not going to go. And in my experience, when people say that, they don't mean it. They actually are going to go. They're just going to go and make a big scene. So, and I know your grandmother's not doing too well. She just got out of the hospital. She doesn't need this kind of... I'm just trying to help. If you don't want my help, that's totally fine. We can just stick to being professional, and I'll check the teeth and send you on your way. I mean, if that's all you want out of this relationship, it's totally up to you. Personally, when someone offers me assistance, they want to help me, I am more than happy to listen. But if you don't want my advice, you don't want my analysis of this situation, I am a professional. Dental professional, mental health professional. Doesn't matter. I'm a professional, okay? I have a pretty fancy degree on my wall. Listen to what I'm saying. Your Aunt Robin is going to try to bust your butt or upend a table or something at this picnic. So you might want to really, rethink it, develop a migraine or something that day. But don't go, because I don't think your grandmother's heart can take another shock. That's just my opinion from spending several hours on your Facebook wall. Okay, now that's just from one friend to another. Okay. Yeah. So I made up a planner here of everything that it looks like you have going on in the next month or so. You don't mind that I took that liberty, do you? Okay. One thing I want you to pencil in, your neighbor. You really need to ask your neighbor out. Yeah. Well, they've been saying stuff about you. They haven't tagged you in anything because they don't want you to know yet, but your neighbor has a real crush on you. So I see that you have a free day 2 weeks from this Saturday. You may want to go see if your neighbor wants to go have some drinks or something. Yeah. Your hair is sticking up. That's not doing it. Dang it. That's just making it worse. I'll tell you what. I have something for everything. Hold still. That's... Oh, now it's sticking up over here. That's better. You don't look your age. Has anybody ever told you that? You have a delightful build. Like, you're splayed out here in front of me. You look great. You look great. You really don't look that old. Well, I would go out with you myself, but I'm kind of seeing somebody, okay? And we're gonna get you fixed up here. It's just hair tonic. Hold still. You're so tight. God. If I massaged your feet, would that help? You're so spiffy. All right. So I'm going to get these tools out here now. I'm going to show you the rest of them. Okay? Showed you one already. Look what else I have. I have a mirror and I have another dental pick. They're slightly different, but slightly awesome at the same time. All right. I don't need to wash my hands. They're good. A little bacteria never hurt anybody. Okay. I'll show you these picks. Here's one. Here's one. They kind of look the same, don't they? But they're not. This one is sharper. It's to get in those little tiny crevices like this. Like that. Here, you try. Ooh, got a little bit of something there. What is that? Up. Okay. Like a little piece of celery or something. How did Laura miss that? She's got to do better. Let me try that one. That got it. Oh, I'll use them together like a pincer. Remember Robin Williams? He said that. It was Mrs. Doubtfire. Never mind. When his teeth fell out in the glass. Forget it. Only dentists remember that. Ooh. Open up. I want to lay you back, but you're so tense. It's starting to worry me. I'm afraid you're going to pass out. Okay. Now, I know Laura mentioned that you... Oh, didn't mean to bump you there. I know Laura mentioned that you need to do better about getting right under here. And then that. Right here. Now, open up. Right there. You need to be getting up in there and brushing better because all that plaque builds up and it hardens over time and it becomes tartar. And, then you're just one step away from your teeth rotting out. So let me look. Open up. Hold still. Your skin is remarkably awesome. It's like you have no pores. And you smell nice too. Ooh, what is that? Scrumptious. It smells like cupcakes and an 8th grade dance. It's just lovely. Oh, look up your nose. I'm kidding. Okay. Now for the unconventional part. I know up to this point it seems pretty standard, but here's what I do. You see this? It's like a tiny alligator. I want you to stick your tongue out. Trust me. Stick your tongue out. Now I'm going to clamp this on your tongue. Hold still. Hold still. Now I'm going to lift your tongue up like this. And I'm going to look under it. And I'm going to poke under there. Is that comfortable? Well, that way, I'm going to let go. There, now. Go ahead. That way, I can check and see if you have any cancers, like oral cancer. Sometimes you can feel lumps under there. You don't have anything. Yeah. Feels good to me. And then I'm going to feel right back here. Open up, stay. Good job. Who's a good boy? I'm kidding. I don't think you have any issues there. Now, to relax the muscles, before I lay you back, because in a minute I'm going to lay you back the way Laura had you. I'm afraid I have to. You're too tense. Not like TENTS. I mean, like you're all wound up. So I'm going to take my little car and we're running over your face and we're running on your forehead. This is relaxing. Isn't it relaxing? This is relaxing to you. It's relaxing if you'll let it be. Up. Drive the car over the hill. Back and forth. You're not relaxing. I swear, you patients are all alike. Just give in to it. Give in to the car. Give in to the car. Go like that. I want to do your neck. Okay. I think that's about the best I can do. Now I'm going to lay you back. Are you ready? I want a full report on what happens when you ask that neighbor out. Now, if you can't do it, I can go do it for you. Well, I know where she lives. Of course I do. Why would I not know that? Here, lay back. You are so silly sometimes. Is that better? Awesome. Okay. Now, are you comfortable? Okay. I want to look way back. I'm going to take my mirror. I want to look way down in there. Okay, hold still. Hold still. Pretend you're a dead person. Of course, if you were a dead person, this would be pointless, wouldn't it? I would be like your mortician, and I would be adding formaldehyde to your body and stuff right now. I certainly would not care about the health of your gums and your teeth. That would be silly. I crack myself up. Like this. Okay, I'm going to take my finger. I'm going to pull your lip down. I'm going to look on this side. Okay. Yeah, you have a little bit of swelling back here. A little bit of gingivitis. Not bad, but you want to make sure to floss back here a little bit better. In fact, we can get that right now. I'm going to show you what I recommend to my patients. And you can get these about anywhere. These are Dr. Fresh Cool Floss individual flossers. Now, don't reuse these, okay? I tried to donate a whole box of used flossers to the church for, projects for Sunday school, and they reported me. I don't understand. Yeah, I'm still dealing with that. Now I'm going to take this flosser right here. Let me show you. Have you ever used one of these before? Okay, these have been around for a while. There are different brands, so you don't have to get this kind. But this is what I typically buy. Now, you have a little pick right here, and then you have the flosser, and it goes up like this. You kind of stick it up in between your teeth like that, and go back and forth. And you get it, all up in the gums like that. Like that. See, there's nothing on there because I floss on a regular basis and my teeth are wonderful. Now, if you have something stuck in between your teeth, you can do this. Like you just take it like a little toothpick and you just do like that, Here, let me try it on you. I'm serious. Hold still. No, I don't mind using this one. Hold still. Okay, I want to get this side first. Over here where you have all this swelling. Now, your gums are bleeding right now. Do you know why they're doing that? Do you know why they bleed? That is your body's way of trying to fight bacteria. I don't know if anyone's ever explained that to you. That's what the bleeding gums is about. It is your body trying to fight off the bacteria that you've allowed to build up around there because you don't floss properly. Hold still. So your body is trying to fight it off by having extra blood flow in that area, and that's what causes the swelling. Now, if you remove all that junk and keep it out for a little while, that swelling will go away. But you have to floss every day. No more half-assing it, pardon my French. You have to do it right. See? We're getting all manners of garbage off. Ugh, God, your teeth are bad. Did Laura not floss? Did she not floss you? Well, if she did, she didn't do a very good job of it. Okay. That's better. Now I need you to hold still for something else. You know what this is? That's right, this is a measuring tape. And I seriously doubt this has ever been done to you, but I'm going to measure your head. Okay? I'll tell you in a minute. Hold still. Put this around your head and measure. My God, you have a melon. 22 inches. Your head is enormous. See, that's what I thought. Well, I'm already thinking about Christmas, and I was thinking maybe I could get you a fedora, because I really think you need one. Do you have a fedora? From looking at all your pictures, I've never seen you wear one. You have a fedora face. And let me measure twice, cut once. Let me measure that head again. Not that I'm going to cut it. Not today. Oh my God, your head. Well, how big is my head? Do you want to measure my head? Fine, I'll measure it. My head might be a melon too. My head is also a melon. We have the same size head. That must mean we're really smart. Yeah. Gotta have something to hold that big brain. Okay, well, fedora. Fedora time, definitely. But I needed to know that before I buy a hat. One more thing. I need to measure from ear to ear. Let me do that before I forget. So 22 inches around. Hold still. Don't get up. Don't get up. I hear your phone ringing. Don't worry about it. It's probably not important anyway. Well, it can't be your sister. You never talked to her. You need to rectify that as well. Your mama's worried about it. I'm going to set you back up now. Do you think you're okay? Come here. Come on up, nice and slow. Is that better? Is it not? How's that? You look so much more relaxed. Oh. Do you think I'm a good dentist? Yeah, well, we all have our doubts. I like your watch. That's pretty. One time I stole a watch in the mall. Don't tell anybody. Well, that just kind of reminded me of it. Okay, now, before you go, we have a few more things we need to deal with here. Now, I know Laura did the little buffer thing on your teeth, like the thing that you buff cars with. But I want to use my own personal toothbrush on you. I do this for everybody, just to make them feel welcome here in my dentist office. This is my personal toothbrush right here. It's a Philips Sonicare, and you have sensitive teeth just like me. I know, it's like we're long-lost relatives, which maybe we are. I'll find out when we get the DNA tests back. Don't ask. So we have Colgate Sensitive, and I'm going to put some on here. Yeah, it is my... No, I didn't change the head. It's perfectly fine. Look, it's not splayed out or anything. No. What kind of toothbrush do you use? Yeah, I know you were using an Oral-B, but I noticed you don't have it in your bathroom anymore. So I didn't actually see a toothbrush in there this morning. Well, I may have peeked in your bathroom window. Don't get mad. So where was your toothbrush? Oh, well. Okay, hold still. Now, it's all right. Just hold still. Okay. Ooh. You can spit right there. That's fine. Now, see, we have a bond. We have established a bond. We trust each other. Okay. One more thing before you go. Because, I'll be honest with you, this is the first time I've had a patient really make it to this point. Usually when I pull out the toothbrush, they run away. And it really hurts my feelings. So for staying, you get some Unicorn Snot. Okay? So I'm just going to unbutton your shirt. Hold still. I'm going to unbutton your shirt right here. A little bit. Now, this is glitter. It's body glitter gel. And it's called a Unicorn Snot. It's not actually snot. Well, I don't think it is. See? See? It's all over the lid. I'm going to use what's on the lid. Okay? And it's very subtle. Look at that, though. Oh, my God. Hold still. Hold. No, trust me. Trust me. Hold still. Right there. And I'm going to put a little bit on your cheeks. Just for fun. Because everybody needs to be, everybody needs to feel festive sometimes. Don't they? Don't you think? I'm going to put some on, too. Just to show you that I like it, too. What do you think of that? Boy, I bet you didn't expect that today. And this is all included in your copay. Now, when you come in next time, I hope to have some red and pink Unicorn Snot. I've ordered it, but it hasn't come yet. So today all I have is the silver. But I have to tell you, it looks beautiful on you. It's very youth-making. Do you have any questions for me? Anything? I have been a dentist for a while. Where did I go to school? You've never heard of it. It's not a school around here. You wouldn't have ever heard of it, so let's not talk about that. I have as a lovely parting gift for you today, which you're really going to need since apparently you don't have a toothbrush in your bathroom. I have some True White Sensodyne toothpaste in here for you. And a new toothbrush. You can see it's kind of an ombre looking toothbrush. And I put a unicorn on here because you're my little unicorn. You are very special. And don't forget how special you are. The Unicorn Snot should remind you. I know it feels a little cold. When you first put it on, it feels a little cold. But that goes away after a while. Your body heat will warm it up. You won't even notice it anymore. Okay? So I want you to take this. And it comes in this little carry case. And it has a little Ziploc thing on the top. So you can take this little packet home. And would you like to go ahead and schedule your next appointment? What do you mean you have to call me and tell me later? It's 6 months from now. You can't just pick a date and come back in 6 months? Please? Oh, thank you. Thank you. Thank you. How about, hold on, let me check. What about January 23rd at 12 o'clock? Okay, I got you down for January 23rd at 12 o'clock. Thank you so much. You don't know what this means to me. Can I give you a hug? Please? Can I give? Thank you. Oh, thank you so much. That's too good. Can I get another one? I'm so glad that you came in today. And I cannot wait to see you again in 6 months. Okay? Well, you ask your neighbor out, okay? And you won't hear from me again before then. Okay, so that's up to you. Okay, great. I will get Laura to come in and she will take your bib off and everything because I don't touch bibs. I went to school, so I don't have to do that. So she'll come back in and get your bib and write up a little appointment card for you. And unless I see you sooner, we'll see you in 6 months.